Hello everyone, I am Dr. Rupsha and today we are going to talk about what every medical student or junior doctors hears about but hardly know what it is. That is a clinical audit. Some people hear the word audit and they are like with some kind of paperwork and statistics. But the truth is a good clinical audit can not only help your hospital work properly, it will also help in patient care as well as it will help your CV stand out anywhere in the world. In this video, we are going to deep dive into audit. What is audit? How to prepare it? How to plan for it? How to collect data? How to analyze and present it? And also how to re-audit. Whether you're a student, an intern or also an RMO, this video will help you plan and work out your own audit and complete it on your own. At the end of this video, I'll also share some editable audit templates so that you can download it. And after that, if you still have doubts, you can comment below. We will cover this in the next part of the series. So now let's start from the basic. What is a clinical audit? A clinical audit is a process where we see what we are actually doing in practice and then compare it to the guidelines and standards and see if there is a gap. Just like how we check BP of a person and compare it with the normal range, it's the same thing. We check the hospital's performance and compare it with the actual guidelines or standards. For example, if a guideline says like every patient with head injury is going for CT, it should be within 30 minutes. But in your hospital, it takes every patient with head injury 1 hour to get the CV, then there's a gap. An audit helps to identify the gap, find the reason behind it, and helps for the improvement. It's not research. We are not testing a new treatment or collecting data to publish. We are improving an existing system to make it safer and faster for patients. So remember, what is an audit? Measure what you do, compare with standard, make it better and check again. So now you might wonder, why is this so important? First, for patients. Because a well-run audit directly improves the quality of a patient's care. If delays are reduced, if errors are avoided, patients are safer. Second, for you as a doctor, because doing audit teaches you management skills, teamwork, data handling, as well as problem solving. Third, for your career, because every CV, be it for NHS or other systems abroad, they ask about quality improvement or audit experience. When you can say, I found a problem, collected data, analyzed it and implemented change, it shows leadership, not just academics. Now the biggest question people ask is, where do I even start? So I would say choosing a topic is actually one of the most important steps. The easiest way, ask around. Talk to your consultants or seniors. Every department has a few problems that everyone knows but nobody has fixed it yet. Few examples like long waiting times in emergencies, incomplete drug charts, delays in sending patients for imaging, missing consent form. All of these can become good audit topics. You can also look for patterns like repeated incidents, frequent near misses, or areas where staff often complain. I would say the best audit topics are common, where you can get data very easily, measurable, where you can count or time something, useful, it will make real improvements when solved. Like example, the audit that we are doing in our hospital, in our emergency department, the patients were waiting too long to get a CT scan. The patients with head injury, they were waiting too long to get CT scans. So we decided to audit the time taken from decision to CT scan for head injury patients or suspected severe patients to be within 30 minutes. So it's measurable in minutes, has a clear guideline like CT within 30 minutes, and solving it would really help patient care. Now here's the structure that makes audit easy to remember. There are 6 basic steps in every audit. Number 1, identify the problem. What exactly are you going to study? Number 2, set the standard. Like what's the guideline you will compare against. Number 3, collect the data. Measure what's currently happening. Number 4, Analyze the results. How many met the standards and others why they did not meet the standards. Number 5, implement a change. Take real action to fix the problem. Number 6, and the final most step, and one of the most important steps, is re-audit. Check again to see if it improved. If you do complete all the 6 steps, your audit is called a closed loop audit, meaning you didn't just identify the problem, you actually solved it. Now we will go a little elaborate on how to write your audit and how you will plan and do the protocols. Now, before you start collecting any data, you must first prepare your audit plan, which is also known as the audit protocol. Think of this as a blueprint or roadmap to your audit. It tells anyone who is reading it exactly what you are trying to do, why you are doing it, and how you're doing it. Without a clear plan, you will just collect random data that will be of no use. So let's just break this down step by step. Number 1, that is the title of the audit. The title should be short, clear, and tell people exactly what you're studying. Example, audit in time from decision to CT scan in head injury patients in the emergency department. Avoid any fancy words. Make it descriptive. Someone who is reading just the title should instantly know what they are looking into. Second, the department and the time frame. Mention it in there that where you want to do the audits, that is where and when the audit is going to take place. Example like department, emergency department. Time frame, retrospective audit from April to May 2024. If it's retrospective, you will collect data from the past records, and if it's prospective, you will collect data in real time. Usually 1 to 3 months of data is enough for your first cycle. I wouldn't say to make it too long. Keep it short on your first audit because it will not be very overwhelming and it will help you a lot. Number 3, audit teams. List everyone involved. Doctors, interns, nurses, data collectors. Write the names and roles clearly. If you're doing it alone, mention your own name, like you're the person who is collecting data and implementing the change. If you're doing it in a group, like we are doing 3-person, we are doing together, me and Dr. Bishal, and we are doing it along with a consultant in our emergency department. So all 3 of our names will be mentioned there. I prefer small teams. You can obviously do it alone, but I prefer small teams because it reduces the workload a lot and it's not very overwhelming. In number 4, you're going to mention the background or the rationale. This is your why. In 4 to 6 sentences, explain why this is your topic. For instance, in our emergency department, our hospital guideline follows that any patient with head injury or suspected stroke, the decision taken to time of CT should be within 30 minutes. But few of the patients are getting a CT scan after 30 minutes or within 1 hour. For instance, this is our background or rationale. I'll just read it out to you from our blueprint. For instance, in our emergency department, patients with head injury often experience delays in getting CT scans. According to our hospital guidelines, CT should be performed within 30 minutes of decision. Delays can lead to missed bleeds and worse outcomes. Hence, this audit aims to identify the causes of delay and implement changes to improve patient safety. This paragraph shows that your audit is meaningful and is patient-centered. Now coming to the aims and objectives. In here, you will write in 1 sentence. Your aim is the big goal in 1 line, that is what you want to achieve. Like in our case, it is to evaluate whether CT scan in head injury patients are performed within 30 minutes of decision in our emergency department. Then you will write the objectives in smaller measurable tasks, like to measure the average time from decisions to CT. Then to identify the percentage of cases that are meeting the criteria of having a CT scan within 30 minutes. To find and identify the main reasons of the delay. To suggest and implement changes. Keep the aim broad and the objectives should be very specific. Now coming to the standards and criteria. This is the heart of the audit. you must define what standards you're comparing against. It can be any reliable sources, like you can compare it with the NICE guidelines or the American guidelines or your own hospital policy or hospital guidelines, whatever it suggests. Like for us, we set the standard like all adult head injury patients should receive CT scan within 30 minutes of decision taking. And our target is 100% compliance. Write both the criterion, like what should happen, and the target, like how many should meet it. Now next is sample size and sampling method. Now this here you have to decide how many cases you will include. It can be from 30 to 100 cases. I would suggest to keep it a little bit low, because like if you keep 100 cases for head injury or suspected stroke patients, like it will take a long time for you to meet all the criteria, because not all patients coming to the emergency department are head injury or suspected stroke, suspected CVA patients. So choose your number of cases or number of patients you're going to take according to your topic. I would say between 30 to 100 is a perfect number of cases for your first audit. It is enough to show a pattern, but also it is manageable. Then you will specify how you will select them. It can be consecutive sampling, like all eligible cases in the time period, or random sampling, like every alternate cases from the time period or from the records. Also mention if it is retrospective from case sheets or prospective in real time. Now you have to write the inclusion or the exclusion criteria. In inclusion criteria, define which patients you will include in your case study. Like in our case, we are including adults more than 16 years who are attending the emergency department with head injury or suspected CVA. And we are for the exclusion criteria, we are excluding transferred cases with CT already done elsewhere or pediatric cases which are less than 16 years. So this keeps your data consistent and avoids any confusion later. Now coming to data collection method and pro forma. Write clearly how you will collect the data. Like it can be from case sheets, from radiologs, or from CT register. And then you will record the information in the Excel sheet using a predefined pro forma. Now talking about the table format or the Excel sheet or whatever you call it, the columns that you're going to store the data or you're going to collect the data and what you're going to collect. Like in our case, the first column is the serial number and then the patient ID, then age of the patient, then diagnosis of the patient. Now the three most important parts: the arrival time of the patient, the decision time that you have taken when you want to do a CT, and then the CT done time, that the CT has already been done. Then we have to take the total minutes in the next column, that is from decision time to the CT done time. We have to mention there the time, like it will be maybe 30 minutes, it may be 20 minutes, it may be 35 minutes. And in the next column, we will give the target was met or not, that is yes or no. And the last column is the reason for the delay. If there was any delay, then what is the reason for the delay? And in the final column, we will give remarks, like it can be your own remarks, what you want to give. Plan to keep the patients anonymous. Don't mention the patient's name or anything of that sort. You might want to use numbers like P01, P0, that's patient 1, patient 2, patient 3, like this. Now, this is for your own safety, like data storage and confidentiality. Always state there that data will be kept securely. In a password protected sheet, there will be no patient identifiers. It will be used only for the audit purposes. It will be deleted after completion. Now you have to take approval and set a timeline. Before starting, I would suggest you inform your department head and consultant. We are already doing it under a consultant, so we did not, like, information was like that only. But if you are doing it alone and nobody knows in the department, it will be difficult, so you must inform your consultant of the department you're working in. I have heard that some hospitals require a simple registration form for doing a clinical audit. Please check with your hospital if they do the same thing. Now here mention exactly the time frame you're going to do, like data collection from like 1st July to 31st July. Then analysis from 1st August to 30th August. Presentation in mid-September. So setting a clear timeline will really help you as well as others to understand. Now, next point is you have to write the expected outcome. That is what you are expecting after doing this audit. Like for us, it's reducing the time of patients getting CT in head injury patients from 60 minutes to 30 minutes in like 6 weeks or 1 month or whatever it is. Okay, some extra tips I want to give is if it is your first audit, try to keep it very simple. Make it like 2 to 3 pages max and keep it short and simple and precise so that if a senior or a consultant, they are reading it, they might know that what you're doing, that this team really looks promisable or this audit topic is good. Like they should understand it. So with that, we come to the end of how you write your audit plan and protocol step by step. Once this document is ready, rest of it is very easy. Like you have to collect the data, you have to analyze it and present it. Becomes much easier. Now after you collected all the data, like I said, now come to data analysis. Now once you have your data, it's time to analyze it. I would say you don't need any fancy statistics, just percentages and patterns. Like for example, out of 50 patients, say you're doing the total audit on 50 patients. Out of 50 patients, only 20 patients got their CT done within 30 minutes. So compliance is equals to 40%. Then look for the delays. Why there was a delay? Like not enough technicians, like 5 delayed due to radiology being busy, then 5 delayed due to not enough CT technicians, 2 delayed due to missing forms, etc. Now you can put them in charts. I would love to put them in charts because I like visualizing in a picture format. So it can be a pie chart or a bar graph, like why there was a delay and what can be done to reduce that delay, like why, like percentage that are meeting the standard and percentage that are not meeting the standards, and pie charts or bar graphs for what are the reasons for the delays, like the common causes for the delays. Now this is the part that you will show for the presentation or the report. So make it good and understandable for people to read and relate with it. Now coming to the action plan. Now the real goal of the audit is in making the improvement. Once you have found the causes for the delays, you share it with your seniors and other staffs that are working along with you in that. Also sit with your consultants and nursing heads and make out a practical solution, what can be done to make it better. Like few examples are make a fast track process for head injury cases, then assign a dedicated porter for CT transfers, simplify consent process for getting emergency CTs, etc. like that. Document the every action you take, like who did what and when. That becomes a part of your audit report. Now to complete the audit cycle, you have to re-audit. But before you do that, the most important part is you give a gap. So after implementing the changes, you wait for a time being, like give a few weeks of time, and then you re-audit. You do the same thing that you did in the first audit part, that is collecting data and everything should be same. You have to use the exact same method so that it's comparable. And now if your compliance becomes better, like it was 40% before, now it has become 80%, that means your audit worked and your intervention actually worked. This is called closing the audit loop. Even if it didn't improve, mention that it didn't work and plan again. That's how system improves. Now writing and presenting the audit report, you have to write the way I told you, like all those aims, objectives and everything. I'll give a proper one by one description of what you need to do. Like first, your audit should include the title, authors and the date, then the background and rationale, the aim, standards and methods, the results, that is the tables and the graphs, the discussion, why things happened, the action plan and re-audit results, the conclusion, that is the summary and the recommendations, and the appendices, that is the forms, proformas and the chart. Present this in your departmental meeting. Speak confidently. If it is a meeting, speak confidently. You might take videos and photos. It will really help in your CV, I would suggest. And focus on the improvement that you have achieved. Now, few common doubts that people ask is audit research. No, it's not a research, it's quality improvement. Second is, do I need ethical permission? No, you don't need any ethical permission, you just need departmental permission. How many cases do I need for my audit? It totally depends on the audit topics. You can start with 30 audits, 30 cases. It can be between 50 to 100 as well. Can I do it alone? Obviously, you can do it alone. It's not a big issue if you do it alone, but if you take a team like 2 or 3 people, if you're doing it together, it does help reduce the workload a lot. Can I use it for the CV? That's the actual question. Yes, you can use it for the CV. Mention the title, the role you followed, and the improvement that you achieved. So how does audit help your career? Doing a clinical audit, it shows that you are not just a doctor, you actually see the problems and you solve them. In NHS or in other countries, this is one of the strongest points in your CV. It also gives you something to talk about in your interviews. What was the issue? How did you collect the data? What change did you implement? What was the outcome? These are the few questions that helps you stand out. If you found this helpful, please share it with your batchmates or colleagues. That's it for audit as of now. You can download our free audit template pack. It has an Excel proforma, a sample report, and a one-page checklist. Link is in the description below. Comment below if you have any doubts or if you want me to make videos on specific audit topics like how to present an audit in an interview, how to write about that you have done an audit in CV. This was part of our We Medicos journey, helping doctors learn step by step through our own journey. I am Dr. Rupsha and I'll see you in the next one.